Okay, but real quick, shameless plug right there on Amazon. You can see my book right here, Bigger, Better Dental Office, right there. Has all the pages in there regarding how to build a big office. My office is one of the biggest ones in town. It has multiple doctors in it with several hygienists, and it's really created a practice for me that has worked out well. So that book shows everyone how I did it, and if you're interested in it, there it is on Amazon. Okay, now back to the video. Okay, so this video is going to be on packing retraction cord right before you're getting ready to take an impression or do a digital scan for Crown and Bridge. So what is the goal of packing cord? Well, it's to expose the margin so that when you actually do the impression or the scan, that you can actually register that outer rim, which we call the margin, so the lab can build it. Or build a crown on it the way it's supposed to be done. So let's kind of take this high-tech drawing I've made and to kind of show red, of course, is the gum line. Here's the prep tooth, and the margin a lot of times is right about at the gum line. So we want to pull the gum line down just temporarily so that we can register this information right here and get that to the lab so the lab can make a very nice fitting crown. So we want to place cord. So this is like a cross section. If you're going to kind of cut through it and cut right through the middle of the cord needs to go down below this little point. That's the margin. It needs to go below that area to keep that margin exposed. What you don't want is the cord to be laying against the margin. So you might have the gum tissue down, but if the cord is laying against the margin, now you've just taken the gums and substituted in the cord. And so it doesn't really get the final result of what we're aiming for. So to reiterate one more time, what we have is the cord is below the margin. That's good. If it's sitting right on the margin, that's not so good. Okay. And for those of you who don't know what a margin is right where we do the prep for the crown. It's this rim that goes right around the outside. Okay. Let's go here. What kind of materials are we going to need for cord retraction? Well, we're going to need a cord placer. Cord placers or packing instruments come in a variety of shapes and sizes, thicknesses, and so forth. And so you just have to find one that works well for you. I look for width and shape and thickness when trying to figure out which kind of packing instrument to use. For example, I like this shape, but I don't like the pointy shape because to me this was going to poke the gum tissue. You think would poke the actual cord into place, but if you slip or go off, then it pokes the gums, and that's not too friendly to the gums to have something like that. This one shows two different ones. This one's the one that I end up using, and this one's a little bit wider. To me, it seems it's just a little bit clumsy when they're in there trying to do it. Plus, this one's a little thicker. You can hardly tell in this photo, but it is just that little bit of extra thickness that in my hands is a little bit too difficult to work with. So here's the one that I work with. It has this kind of shape. Different manufacturers make them. You just have to kind of try them out to see which one works the best for you. Cord. Okay, we need actual retraction cord. There's several of them that are out here, but I like the one made by Ultradent called Ultra Pack. They come in a variety of sizes, as you can see. I do pretty much 95%, if not 99 to 100% of my cord packing with this 00 cord. The only time I might use this just single 0 cord, the purple one, purple and white, is if I'm going to do a double cord technique, which I will go over in just a moment. What I like about the Ultradent product is that the design of how this cord is made, it has this kind of webbed, woven shape to it that when you take a packing instrument and pack down on top of it, you can tell that it's going to allow the cord or the cord placer to actually push the cord into the sulcus. Here's that cord, that 00, again, kind of a close-up picture. You can see all these little frayed ends. Don't worry about that. That's microscopic. Doesn't cause a problem at all. What I also make sure is that we don't have bleeding around the sulcus when you're trying to pack the cord. And so we're going to need some kind of astringent agent or some kind of styptic agent. And we like Kisco's product called Cutrol. It seems to work really well. Ultradent makes one called Viscostat, and there's several other ones out there in the market, but I find that this one works really well. So getting the gums nice and clean, ready to go is good, or at least stop the bleeding. Another thing you can do to kind of help stop bleeding, as with any kind of wound, if you cut your finger and you put some pressure on it, that'll stop the bleeding. Well, this does kind of the same thing. If your gums are bleeding, you can take these comper caps, they're kind of dished out here in the middle. You can actually fit that over the crown prep and have the patient bite down on that for a couple of minutes, and that will help stop the bleeding. What about the technique? How do you now put the cord in? And this is just something that you just need practice. It just takes time of getting it just right so you can get the cord in. But I'll give you some little tips here on how to make it easier. So here we have two different fields to put a cord in. You can either have the field dry or you can have it wet with either water, saliva, or with blood. You don't want either one of these. It makes it very difficult to get the cord in there. So you want to have it dry. So cotton rolls, triangles, whatever it takes to keep the area dry right before you place the cord is going to help out a lot. Plus, you're going to want the cord to be dry. When you're putting it in there, if the patient does one of those things and gets saliva on the cord or it starts to bleed and the cord starts getting wet, it's hard to put that in. Even if the field is dry and the cord is wet, I find it very difficult to put it in. So if you find you run into that problem, just forget that cord, grab a new cord and try putting in. You want to have a dry cord when placing. Okay, so what do you want to do when you start the cord? How should this cord be oriented? First, I have to cut it to about the right length. I always kind of cut it a little extra long so I can snip the ends and kind of custom fit it when I'm done. But you want to have these ends, I call these the terminal ends, or you want it to terminate the cord on either the lingual or the buccal. So either configuration is fine. You just don't want the ends to meet up on the mesial or the distal. So what you do is, let's just imagine we're going to have the cord laying like this. I want to start right here. Start somewhere in the middle, mid-buccal, we'll say in this case. And then once that cord is in, then I start working my way around to the mesial and then work my way around to the distal. Okay. What you want to do is kind of continue along this path. You don't want to start here, get to the interproximal and think, well, that's kind of hard to get to. I'll get to that later, and jump over it and start putting in this piece. You don't want to do that. You want to just kind of keep going along. Problem is if you try to skip over an area and think you're going to get back to it later, you're going to find that you're going to have too much, or maybe you pull too tightly and that middle piece just doesn't want to cooperate. It doesn't want to go inside the sulcus. So again, start from one way and work your way around. Come back and do this way. To start here, let's just say, and work your way around 360 degrees this way or vice versa, I find that a little difficult. I mean, it's definitely could work, but I like to start in the middle, go one way, then go the other. Now, when you're getting this in place, you might have a little extra cord that wants to not lay inside the sulcus, but wants to kind of bow up a little bit, or it creates I call it a small loop. Well, you can take the cord and kind of pull it. The part that's in the sulcus that's kind of ahead of it, you can pull it and it kind of cinches it like a necktie. So let's just imagine for a moment, right here was a little loop or a little part of cord that wasn't going down, but let's just say this part was already in. I would take this part and actually pull it just a little bit, and that should help cinch the loop down inside the sulcus, or at least make it easier for you to then do the final tuck in with your instrument. So that's a little tip right there. How much pressure should you actually apply to this cord when you're putting it in place? I'd say think about a mechanical pencil. You're writing with a mechanical pencil, the lead, you know about that pressure. If you press hard enough, you can break the lead. So the amount of pressure you want to have is about that much, like right up to the point where you'd break the lead. That's about the amount of pressure you want to put on these instruments. If you push too hard, obviously if you slip, you can actually go right down across the gum line and maybe even peel some of the gums off of the bone, which patients really don't appreciate a whole lot. So about that much pressure. The other part too is when you're putting in the cord, right before you do your scan or your impression, it has to be dry. Well, you're going to go with an air water. You're going to clean off the field and hit it with the air just to dry it. If the cord doesn't stay in when applying air, then that's not going to work. So when you place your cord, you think you're done, test it with the water and air to make sure that it truly is going to stay in place. In this example up here, it looks like this is going to stay in place just fine. Right here, this part is kind of hanging out. If the air gets underneath it, you can see how that cord might just lift right out. And of course, this one, if you blow air on that, that's going to come out as well. So the cord has to be tucked in completely in order to withstand the air water. Another question is, should you leave the cord in while taking the impression, or should you take the cord out right before you do the impression? And different dentists have thoughts on how to do this. Either way will work fine. There's pros and cons to each one. Of course, if you leave the cord in, you have to make sure that the cord truly is down all the way and not sitting up in the margin like I talked about earlier. But if you take the cord out, you have to make sure that it doesn't start bleeding right away, and you have to get in there quickly with your impression material before the gums start to collapse back down on top of the margin. Me personally, I like doing the part where you leave the cord in. Now, there is a way that you could tuck the cord in and do a thing called a double cord technique. So you would take that, in that case, let's say that double zero, the one that I always work with, put that one in first, and then layer on top of that one the zero. Let's see, where'd it go? Here it is. So you'd put in this one first, and then on top of that, you'd put this one. Okay, I know those colors don't match up with this cartoon, but that's what we're doing. Small cord goes in first, thicker cord goes on top. And what happens with this is when you're getting ready to take the impression, you take the top cord off, you leave the bottom small cord in place, and now you kind of get the best of both worlds. One, you get the cord still in place, holding the gums at bay, but you did get the large cord in, even stretching the gums a little bit further, so that when you do take your impression, it is kind of stretch the gums out to its most maximum, so you can get a very nice impression or scan for that matter. Should you snip the excess ends and make sure it's completely tucked in, or should you leave an excess end hanging out? Again, this is going to depend upon if you plan on leaving the cord in. Obviously, you need to have everything tucked in. But if you plan on removing the cord right before the impression, then of course you just want to leave a little piece out for convenience. It's easier to grab that little piece in with your cotton forceps and remove it rather than trying to get in there and remove, with your Explorer, trying to get that cord out. So it depends on which technique you like the best. Another little tip is we write the word cord and circle it on a piece of paper that's right there by the patient's instruments as a reminder to the assistant and doctor that cord is in place. So we don't have the patient get up and leave with cord still in place, because that can happen. You can imagine if you leave the cord tucked in and you take your impression and it still stays in, you make your temporary, you cement your temporary, you don't see it, you could forget that the cord is there, and then the patient leaves and they call up the next day and they say, hey, I have a little string hanging out from underneath my temporary crown. And that can be rather embarrassing. So thankfully it doesn't cause any real, major damage, but it just looks bad. It looks like, the office forgot something, which it did. So we write this down on a piece of paper just as a visual reminder so we can remind ourselves to remove the cord before the patient leaves. Last couple tips here is to try to leave the cord in until the temporary is cemented. Now, of course, you run the risk of forgetting it. So imagine this, you do your impression or your scan, cord stays in place. You now make your temporary. Now with the cord still in place, the gums are out of the way, so you still have a very nicely exposed margin. So now when you make your temporary, when you pull the temporary out, you're trying to trim the temporary, you can see really well how that looks. And then I'll even say I leave the cord in even when I'm cementing the temporary. Because when the temporary cement has set, you kind of go in and clean up all the gross excess that you can see. But then right at the end, you take the cord out, again, remembering that it's there. You take the cord out, now it pulls any cement that got inside the sulcus and cleans it out. So now the patient leaves with a temporary in place and a clean sulcus. But remember, you have to remember to take the cord out, because once that temporary goes on, a lot of times you can't even see the cord. You have to get in there and fish it out with your Explorer. I'd say if the cord does come out during the impression or when you're making the temporary, and that's okay. Like I just talked about, how it'd be nice to leave it in during the entirety of the temporary fabrication. But if it does come out, that's okay. You don't have to tuck it back in. If a little piece comes out, you could tuck it in if you wish. But if it comes out completely, you don't have to go put a whole new cord in just to get through the temporary. And then lastly, just a little pet peeve of mine is if the ends are a little frayed, then like right here, if this little purple piece comes on, it's a little strung out and comes out to here, that just kind of gets in the way when you're trying to do your impression or make your temporary. So we like to clean up any little loose ends when we're tucking in that last little bit. Okay, so the next part of this video is going to show on a model and both a live patient example of placing cord. I'm going to be kind of scrubbing through the video to go kind of quickly so you kind of get some idea. I'll be commenting on that. But I will have a second video as part of this two-part series that shows those two videos in real time so you can kind of see how long it really takes to put one of these cords in. So that's it. Let's go to the video. Okay, so with this video, I'm going to be showing how I place cord on a typodont, and then I'm also going to show a second video right after on a real live patient. So let's start here with the typodont. Took the string, you can see it can orient it either where the tips, the ends are either going to be on the lingual side or the buccal side. In this case, I went with the lingual side where the ends are going to end. So I'm going to start on the buccal. And kind of on a rubber model like this, a little hard to get this started. Let me kind of zoom ahead a little bit. Let me pause it actually right there. Notice how the cord is a little frayed. If you take the instrument and you poke at it enough, those fibers, as well as they're kind of braided and kind of formed, they can start to fray apart. So you want to make sure you don't get in there too hard and dig around. Otherwise, it might get very difficult, or leave little ends exposed that will hang outside the sulcus. But once we get it going here, let me get this started. There we go. You can see that the direction. I'm going to be taking the instrument. You see I might be pointing the toe of the instrument either towards the end or maybe away from the end. It's just kind of feeling around that socket and just trying to get it tucked inside. Obviously, I'm pointing it down the root of the tooth. I'm not actually pointing it straight down. It has a little bit of an angle going down just to kind of cinch it around, where the margin is. And you can see I'm just kind of going in that one direction. I've just started. I'm not going to now jump from this buccal side straight over to the lingual side, coming back to the direct interproximal. Instead, I'm going to kind of work it around. If I need to go ahead a little bit just to kind of get the cord kind of started, I'll do that. But then before I actually tuck the cord in all the way, I'm going to go to the part right there. I went to this area, and you can see now I'm working my way across. Okay. And so you can see I'm just kind of flipping the instrument around, whatever feels ergonomically the most comfortable, and still get the job done. Again, on a rubber model like this, it's a little bit more difficult, even though there's no blood or saliva in the way. It just has a different feel than when you're actually in the mouth. And so you can see I've kind of worked my way around and just kind of tidying it up a little bit to make sure it's good. And I'm going to this other side and just kind of working that instrument around. Again, this just comes with trial and error. It takes a while before you get the hang of this, but you just kind of keep those principles in mind that we went over on the slideshow, and just kind of tuck it in there. So we'll just kind of let this play out. Again, I'm gonna have a follow-up video where I don't narrate and just kind of let this play through without me jumping ahead and pausing and all that kind of stuff. So here I am just going to flip the model around. This is really just for the video, so you guys can see. But it's kind of, I might be trying to lay the cord in there before I tuck it in. Again, I'm not going to skip over an area because it's difficult to get to and think I'm going to come back later. I'm going to just go ahead and get it placed kind of in that sequence. So I'm bringing it around, and let's see here. Yes. So here you see the ends have kind of overlapped. We don't want to have that. We want to clip off the ends. Very important to have sharp scissors when you go in and do this, because if you're just kind of gumming away at it, the scissors isn't actually making the slice. That can be very frustrating. And if you think you've made the cut and you haven't, and you pulled the scissors away, then you can imagine you'll pull the cord right out. I've had that happen a couple different times. It's kind of frustrating after you work so hard, to get that cord in. So you take those out and then just tuck in the ends to make it nice and neat. And that's just kind of the way that we do it. Let's move on to, let's go past this. And, I'm sorry. We're going to show, obviously you take like an Explorer and you get inside and just kind of, tease it out when you're ready, when you're finishing this up, and you can just pull it out. Imagine if there was a temporary in place right there. You could pull and get that away from the temporary margin. And now you can see, you just pull that out. There'd be any cement that would be in there. That cement would just come right out with the cord. So it's kind of a nice little way of ensuring the patient's going to leave with a clean sulcus, not have cement crammed down underneath their gums. And then lastly, I just took this cord and laid it across. We wrapped it around that molar. We snipped the ends so it had the perfect length. And here I'm just going to pause it to show how long of a cord do you really need to wrap around a molar. Well, imagine going from this entire posterior segment from these premolars all the way across the molars. That spans about how much cord you're going to need. You hate to have a cord that's been cut too short and you place and you get to the end and they don't quite meet and you kind of need that to go down. That's kind of frustrating. It's better to have a little bit of excess where they kind of cross over and snip off the ends. But if you're trying to get an idea, well, how much does it take to wrap around a circle? The circumference is pi r squared or something like that. Anyways, it's basically this length right here. It's always a little bit longer than you think it's going to be, at least longer than I think it's going to be. But that's how that works. Now here we are with the live case. You'll notice here, I'm not starting in the direct buccal like I did in the example, but the concept I explained in the slideshow is still the same. I'm going to work from one end, I'm going to point a starting point, or pick a starting point, and then I'm just going to work my way around. So here we go. I'm just going to let this one play out. And you notice I got the cotton rolls in there, keeping everything dry so the patient doesn't go like that, you know, and get saliva up into the field and soaking the cord, because a wet cord is very hard to place. Even though there is some moisture in the sulcus, it's not enough really to soak the cord, at least not the part I'm trying to get tucked in there. Obviously, the part that is in there is getting wet, but the part I'm trying to manipulate into the socket is, or into the sulcus, is not getting wet at this point. Also notice there's no bleeding. And we go in and, of course, have a nice clean prep if you can, but clean it with some kind of Cutrol or astringent agent to kind of get that to settle down. And you can see I'm just kind of working around, again, using that kind of pressure. That's about as much as it would almost take to break a pencil lead. That's kind of the pressure you want to be placing on there. And sometimes even after you get the cord placed, you have to kind of backtrack to kind of tuck in and clean up around the edges. Let me speed this along. Okay, kind of working my way around. And there the ends are. Okay. Oh, no, actually, yeah, it looks like that one, they may have overlapped slightly, but it was fine. And again, remember, we talked about water and air. It has to be able to withstand that. So here I'm cleaning out the sulcus, cleaning out any debris and water, and blasting it with air, making sure the cord stays in place. And looks like a little piece of it kind of came up during that, so it's nice to catch that now. And again, I'm kind of pulling, and you can see where the ends are. They kind of ended up in the lingual. I'm kind of cinching, I'm kind of pulling it so it's nice and tight. And you can do that. You can kind of manipulate the instrument across that sulcus to bring it in a little bit tighter. Okay, and let me work through. And here I'm going with the Cutrol agent to just kind of clean it out, wash, dry, the typical things you do to get ready for an impression. And then I'll probably switch out the cotton rolls, and I think my hand kind of gets in the way. Oh, hold on a minute. Let's see if we can see it from an angle. It's kind of tough to get this bounced off the mirror. You can kind of see it. It's not as pretty as in the diagram, but trust me, it worked out just fine. You can see it's starting to bleed a little bit, so you kind of have to be quick about these when you are trying to control bleeding, wash, dry, and get your impression material in there. And then switch out the cotton rolls, and there's the impression material. Sorry, my fingers are blocking the access view to it, but that's kind of what we do. So those are the live ones. Again, I'm going to have these videos play in part 2 in this series. If you just want to see it without me narrating it, just kind of see it in real time, that will be available to you. All right, take care.